If you or a loved one has ever been in the hospital, you probably know how important it is to have someone with you to help navigate the process on your behalf. Today, Dr. Umair Jabbar, co chair, Readmissions Reduction, Cook County Health, will explain why a patient advocate is so crucial. Welcome to Total Health Talks, your Cook County Health podcast, where we empower your journey to better health. I'm your host, Maggie McKay, and today we're going to talk with Dr. Umair Jabbar about collaboration, not conflict, advocating effectively for you and your loved ones during hospitalization. Thank you so much for joining us today, Dr. Jabbar.
Thank you, Maggie, for having me.
So let's just start with what is a patient advocate and how can they help? What does it mean to be an advocate for yourself or a family member during hospitalization?
Yeah, so patient advocate really can be anyone. So there could be formal advocates like we do, like we have at Cook County, that really, provide recovery when, some things are not going right, and the patients feel like they need to reach out. Whether maybe their room isn't cleaned, and they need no one's addressing it, or they're having trouble communicating with their medical provider. So we have formal advocates available to help patients, get their needs addressed. And then informal advocates as well, so you have your family members. We have medical students in our hospital as well, and they can act as advocates. Anyone that, can, address issues. Patients have feelings of exclusion and uncertainty. And if you think around those things, what are the things that are making me feel excluded, disregarded, powerless? And how can we help that? What can we do to ameliorate that? And anyone can advocate that. And then also for uncertainty, I'm about to go home. I don't know how I'm going to do. The hospital feels safer. How can I succeed? Right. And an advocate would speak up towards those issues and help reduce that uncertainty.
And how can I prepare myself or my family member for a hospitalization?
So one of the most important things I think you can do is, come prepared about your own health history. The more empowered you are, the more you can advocate for yourself. So what are the medications you're taking? Because sometimes there's a disconnect between what we've prescribed and what you might have at home. If you go to other health systems, having access to those records, either through an electronic portal, that can certainly help, reduce the amount of tests that we do. That can save you money, saves the inconveniences of undergoing repeated, testing. Talking to your family members about, what are your preferences, for care, end of life wishes. If you have a chronic illness that's progressing, what if I were sicker? What are my priorities? If I end up, getting sicker and going to the ICU, would I want to be aggressively treated, put on a ventilator, or, would I want more, a natural progression of the hospital stay. So those are important things I think to address, and just things like as well, just basic necessities. And I bringing my cell phone charger, bringing contact information for my family members, so that in case you're come in a state that you're confused, we can reach out to your family members and learn a little bit about you and what's been going on with you.
My son always makes fun of me because I print everything out and I bring a folder even when we travel, because you know what? If you lose your cell phone or it goes dead, the battery, you're out of luck. So I say, like when you go to the hospital, I have a folder. It's not thick, but it has everybody's contact numbers. And he's like, oh, Mom, that's like, you don't need to print it. It's on your phone. But I don't think you can be prepared enough. I really don't. And like you said, your wishes. So I think even if you're over prepared, it might be helpful, because there are things you never think of until you're there and then it's too late. So, what are some common discussions around invasive procedures, tests, or complex medical decisions that sometimes are not sufficiently covered and should be asked?
Yeah, absolutely. So, I mean, whenever we're doing testing procedures, we always go over, what is the test? What does it entail? Why we're doing it? What are the risks of it? But I think oftentimes we don't volunteer, and patients sometimes are not empowered to ask about, what if I do nothing? What are my alternatives, right? And that's also important. What if I wait? What if I, see, give it a little bit of time? We sometimes say a tincture of time sometimes helps things. So, those are, I think, important things to also bring up whenever you're talking about anything that might be a little bit more invasive, a little bit more involved, right? So that can help you make a much more informed decision about, and then, meet your own preferences. Okay, this is what my, medical providers would like to do. These are the alternatives. I think I would prefer that as long as it's acceptable to them. And, what are the consequences if I choose to go down that route?
And Dr. Jabbar, what are some hazards of hospitalization? How can patients and their loved ones help mitigate them?
Yeah, I think the biggest hazard we see is decline during the hospitalization. So we notice that, in the literature that a third of patients will have a new deficit in terms of their activities of daily living, just basic necessities of what you're able to do, like feed yourself, bathe yourself. So a third of elderly will have that. And a lot of that has to do with, reduced ambulation, poor sleep, deconditioning. So, getting out of bed in the hospital is very important. It could prevent some of the other hazards that we see, such as getting blood clots in the hospital, developing, pressure sores. So those are some of the things, as well as, just making sure that your healthcare providers are washing their hands, because a lot of some patients will catch, infections within the hospital. So making sure that, you're advocating on behalf of yourself or your family members that, it is our duty to wash our hands. And so that's another way as well that you can advocate and prevent some of the hazards.
I read once that doctors' ties carry like tons of germs. Have you ever heard that?
Yeah. So I mean, there's some literature out there that supports that, but the vast majority of patients do get infections from within their own bodies. But certainly, there are things that we also can do to reduce some of those risks, such as some of the environmental things that we do, cleaning different areas, and protecting ourselves and protecting our patients as well by.
So, what's the typical daily workflow for healthcare providers, and how best can we leverage that knowledge to help communication between patients and their medical providers?
Yeah, so in a typical hospital, most of the physicians round in the morning. So generally before 11 o'clock. I'm not a surgeon, so the surgeons rounds much earlier than I do, and that's why I didn't choose that route. But the surgeons will round somewhere anywhere between 5 to 7 a.m., and then medical doctors typically rounding anywhere between 7 to 9 a.m. Um, and knowing that, it's important to be there at the time of rounds, because again, then you get to see what the plan is for the day, right? So what are the tests your doctors are thinking about? They can give you an idea of what the agenda is for that day. They might be a little bit rushed, but they can give you, some sense of, okay, what's the plan? And, later on in the afternoon is when things tend to calm down. We've gotten the things that we wanted to order enacted, and then we have time to kind of come back and go over in more detail some of the discussions about, sometimes we do end of life discussions at that time. We do, we do teaching, education about your health, and how do you manage your own condition when you go home. So that's afternoon's a better time often for those kinds of discussions. But it's important, I think, to be present on rounds if at all possible, and with your family members as well, because sometimes when you're sick, you don't understand sort of many of the things that are being talked about. So it helps multiple people hear that, and then yeah, oftentimes the patients might not ask, or the family members ask really good questions about the care and what we do when we go home. So
Can there ever be too many family members? Because once my mom was in the hospital and, she has 5 kids and we're all there, and I'm like, this is too many cooks in the kitchen.
yeah, that's a good point. What we try to do is, we try to, if there's a lot of family members, that it's very nice to see that, frankly, right? So you get to see that's a very supportive family. They're all engaged in the patient's care. But to facilitate, efficiency in care, and it helps to have one appointed family member as the family spokesman, who we hear from what the family is thinking, but also when we need to convey information, we can also go through that family member and they can convey it to the rest of the family. So that helps facilitate bidirectional care.
Doctor, how can we advocate for ourselves and our loved ones to reduce the cost of care? Is that even a thing? Is that possible?
Yeah, there's definitely options. I think we don't often think about those, but at the time of discharge, we have the option to look at your formulary. What insurance do you have, and pick things that will have lesser copays. Sometimes we do tests in the hospital that really could be done as an outpatient. After you've left the hospital, you come back for an appointment, and those tend to cost a lot less than had you gotten them done in the hospital. So you kind of have to think about, what other tests do I need now for my doctors to make a decision. And if I don't get them now, they might delay my care. But what are the things that I can put off? And are we doing it just because you're here? It's just convenient, and that might raise your hospital bill. So asking about those things and it might prolong your hospital stay, frankly, as well, right? So those are some of the ways you can reduce the cost of care, and as well as always involving your insurance. So, if we talk about something, it's a good idea to kind of run it by your insurances and say, like, my doctors are thinking about this, is this something that's going to be covered and such? Because if it's something very expensive, it's probably a good idea to check with them.
Can you do that before you have the surgery, or you just don't know what's going to be needed after?
So typically most hospitals have a process where we submit what we'd like to do prior to the surgery to get that approval. But certainly you can also, ask, inquire about that as well. They might want more details, but generally you can ask about these things.
Dr. Jabbar, what are some strategies for overcoming language barriers to ensure that patients receive adequate care and support? Because I imagine that happens a lot.
It does, actually. So most physicians and medical providers will tell you there's a big difference between having a live interpreter versus having a interpreter that you're communicating through the phone or through an iPad. There's subtle, context clues that really help, and our interpreters, live interpreters, are great. They're not always available, but particularly for elderly family members, it really does help to have a live interpreter. So if you're feeling that there's your preferences are not being met, there's discontinuity in how we're taking care of you, it's best to ask for a live interpreter. We can certainly accommodate that in many cases, especially for the common languages such as Spanish and Polish. And then we get that benefit of the cultural competency that comes with some of our live interpreters, and they actually see the patients multiple days, right? So you get some of that historical information as well. That sometimes before we go into a patient's room, the interpreter will tell us that, I just had this conversation with a different medical provider with this patient, or I saw this patient yesterday, and this is what's going on. So we get a lot of extra information that we may not get through our own interactions directly with the patient. So it's very, very helpful. And having family members there as well that speak the language as well can also help us really understand what a patient might be trying to tell us as well. Though by no means is there an obligation to have the family there. We're required to have language interpretation available for all patients.
And you mentioned going home. I mean, sometimes that can be a scary proposition. So what are some ways I can ensure a smooth transition back to home?
Right. So it actually helps to ask about, what are the home supports that are available. Insurance is the biggest variable in this, what they'll cover, what they won't. Right. So asking about, okay, can I get coverage for a home aide that will help me bathe, cook, and clean? And if you have family that are doing that, that takes a lot of work. And do they need some respite? Do they need some, relief from some of that work? It's intensive work, right? So are those supports available through my insurance, through, some of the governmental programs that are out there? What equipment might I need? Do I need a cane? Do I need a hospital bed? Those are some of the things. And I think also what eases the transition for family members is to come in. And before you're about to go home, if you're going home in 2 days, come in and see what are our nurses doing, right? Our nurses, are they, flipping the patient? Are they helping the patient bathe, cook, bathe, and use the restroom? And how are they doing that? What are they kind of doing? What is physical therapy doing to help the patient, move and ambulate, right? So when you observe that, you can practice that in the hospital, and that way you're more confident when you get home, and you reduce that sense of uncertainty when you go home. Catheter care, a lot of different things help by just coming to the hospital and seeing and observing and practicing, really.
Dr. Jabbar, can you share any stories of families effectively advocating for themselves or their loved ones during hospitalizations?
Yeah, I had a recent case where a patient came to us who needed a semi-urgent surgery. And we were rounding, and the night doctors, my medical team, they saw the patient and the family members, and they reported to me on rounds that the patient and the family were very upset. They were warning me about the interaction that was about to occur, because they were told that they need surgery, and they need surgery, fairly quickly. So we went in there, and we tried to make sense of the situation. What are the family's preferences, values, right? And it wasn't really that they were being difficult. It was not at all, right? They were feeling that maybe that the medical staff wasn't listening to the patient, and then the family members really were the caretakers for this patient who couldn't speak for himself, really, right? And the family member felt that we weren't really listening. So when we listened to the family member, she wasn't against what we were offering in terms of surgery. She just wanted to have more certainty that the surgery was needed. And we were able to figure out that if we do a biopsy first, we'll have more certainty that this is the diagnosis, and then yes, the surgery certainly can proceed, because it was a life-altering surgery. The patient might have needed a breathing tube, might have needed a feeding tube after that, and for a family member to make that choice on someone who on behalf of someone who can't make that decision or can't advocate for themselves, that was a big deal. So that's where they were coming from. We were able to ascertain that, and we were able to come up with a solution that really met the medical needs from our perspective, but also the patient's preferences. That we were able to proceed with the surgery. Everyone was on board with that, but we were able to give the family some certainty. Okay, this was the right course that we were suggesting, and there was no harm done. It only took the surgery was going to happen in 2 days anyway, and we were able to, in the day between, get more certainty for the patient. So that was a very effective way for the patient and the family to advocate for themselves, and we were able to accommodate that once we understood where they were coming from.
Right. I think it's so stressful for the family because nobody wants to make a mistake. They want to communicate their loved one's wishes. And then I think it's also, as a patient, sometimes you can feel so powerless. Like, everyone's talking about me and I'm the patient, So all these things you've told us about that we've learned today are so helpful. Is there anything else you'd like to add that we didn't cover?
No, I would just recommend, please feel free to speak up. And, our institution is a teaching institution, so you have a lot of people, coming to see you. But in a way, it's a good thing. So my standard joke that I tell my team, and luckily I have new teams, they laugh every time. But I say, for example, that all these people are seeing you. The patients come, say that I'm answering the same questions, but in a way, we learn more about you, right? If you have a student, a first-year resident, a second-year resident come seeing you, they learn different things about you, and we can take better care of you knowing that. And we joke that you came at the right time. It's Memorial Day. We're having a sale in the hospital. You get 5 doctors for the price of 1, right? So the students have less patience. So talk to them. Tell them your story, and it really does help us, especially as the supervisors of some of the other doctors. To better take care of you. We want to take care of you, but sometimes we're not able to spend as much time as we would like because of how hospital sometimes operates. But we would love to know more about you and better take care of you, knowing everything.
That's right. Power is knowledge, right? Or knowledge is power. You know what? The biggest thing I learned, I had no idea, the few times I've been in the hospital, that hospitals have advocates available for you.
We do, yeah. So at Cook County, it's led by a great team led by Denise Goody, and they meet the patients in the morning. They hand out a quiet packet with an eye mask and some earbuds to help them sleep at night, because that's something that gets often affected and can impact health. And then again, they make themselves available, and they really do. When they call, I make sure I listen, because at that point, if they're being called, then that means we might not have taken care of some things that we should have taken care of. And they really help us provide better care and find out things that we might not be aware of as physicians, certainly.
Because I always think, like, what about elderly who have nobody to be their advocate, or somebody who's new to town who doesn't know anybody? So that in itself is a great thing to know. So thank you so much for sharing your expertise and giving this very useful information to us.
Oh, thank you. I'm happy to be on the program and help patients get better care.
Again, that's Dr. Umair Jabbar. And if you'd like to find out more, please visit cookcountyhealth.org/podcast. As we wrap up another insightful episode of Total Health Talks, make sure to visit cookcountyhealth.org/podcast and subscribe to our podcast. Share and connect with us on social media. Stay tuned for more engaging discussions. Thank you for listening. This is Maggie McKay signing off from Total Health Talks. Stay well.